Again, this is Beverly Washington. I'm here today with Miss Luenetta Jackson, who's founder of her local global Nexus company. And it's about being savvy in terms of the pharmaceutical issue, that side of it, and also the healthcare. So you've been in business for 3 years.
Yes.
And you enjoy it.
I really do enjoy it. Loving patients, I think this is what we're all about. It's being an advocate for patients. But I really enjoy speaking to patients as well as other healthcare providers, physicians, nurses, social workers. And as a matter of fact, the Affordable Care Act actually has put into place a setup for teams, which is patient-centered medical home, for more coordinated care for the patient. So the patient's in the center of our circle, if you will, and then the other healthcare, allied health professionals, along with the physician, are there to help coordinate the care and make sure that the patient is getting the best quality care and getting improved outcomes. Also, from that perspective, even we talked a little bit about technology, but the health information technology that besides your list and the pharmacy having the record of all your medications, health information technology is coming into play to really have the electronic medical record. So all of the information about a patient's medical conditions or even events to the hospital or to the doctor's office, they're all in one particular place, as well as all the insurance information, so that the patient, when they come into play to the doctors, they don't have to fish their card out and fill out that form yet again, but it's already there available. And the information is comprehensive, and it's as the events unfold, it's easy to go back and check that information.
That's great to hear, because whenever you have to see your doctor, you sit there, especially the first visit, you have to fill out all of this information.
Yes.
And sometimes you don't remember dates and the incidents. They ask you these questions, you almost have to have a history book of your own life before you're able to be helped.
Exactly.
And it's just amazing to how many people, especially the elderly, who really don't know and don't understand what is going on actually with their health or their prescriptions or the money costs, co-pays, and all of that. Tell us a little bit about it.
For sure. Well, one thing that with the elderly, I would say that it's always great to have an advocate or someone who can go to the doctor with the elderly patient.
Yes.
Because the elderly don't always remember what's being asked of them, or
Correct.
also they don't remember what they're being told. So it's always good to have an advocate for that particular aspect of patient care. But with regard to the cost of medications, based on the plan that the elderly person or patient belongs to, there's information that's available through their health plan, and those plans typically have what they call navigators, or people to help them navigate through the actual costs, the benefit design of their plan, what's covered, what's not, what are the out-of-pocket costs, if you will, what are the co-pays if there are such costs for the patients. But typically, for the elderly and the Medicare population, with the healthcare reform, or Obamacare, if we'll call it,
Yes.
that actually there are a lot of costs or preventive services that are at no cost to the patient, which is a really good aspect of Obamacare. It's really improving the quality, helping us stay more healthy, but also not charging us for those particular medications, or even some of the therapies that we need, if it's vaccines, or even screening, such as cholesterol screening,
Yes.
or diabetes screening. Those are, at this time, will be at no charge based on the plan that the patient belongs to.
Again, let's see. There were some numbers that we had spoke about, 600 million, and
Right.
so is it cost savings to?
Huge cost savings with the Affordable Care Act.
Okay.
In 2012, the increase, or the cost increase for Medicare patients was 0.4% in 2012.
Wow.
So this is the healthcare reform at work, and showing how we can improve the quality and reducing the cost. Prescription drugs, of course, is something that's near and dear to all of our hearts.
Yes.
We noticed that from 600, since 2010, beginning of the Affordable Care Act, 600 million patients utilize drugs within those plans. That was a $6.1 billion savings, or $2 billion over the last 3 years in savings in the prescription drug costs.
This is epic, as they would say. A savings, so $6 billion
Yes.
was saved due to the
Affordable Care Act.
Affordable Care Act.
Exactly.
Why aren't people listening to that? This is a savings. That means money in your pocket, not going out.
Exactly. And also the donut hole, you know, the infamous donut hole is clearly closing. In 2010, each patient who was on Medicare and used the Medicare prescription plan actually got a $250 check for that one time to help close the donut hole. And as the years go on, there's a gradated scale of how much money is going to be divided or given as a discount for the brand name drugs and the generic drugs.
Okay, let's speak to that brand name, so
Right.
discount. So the generic drugs are just as beneficial
Yes.
as the name brand drugs.
Right. So a brand drug is actually a drug that was brought to market by one of the drug companies, one of the big name drug companies. And the patent on the drugs usually lasts up to 11 years. And during that time, the brand company actually uses that time to recoup the cost of research and development, marketing, testing, post-marketing surveillance. And after that time, a generic company, which is sometimes is actually the brand company making the generic, can come along and make those same drugs, those same chemical entities that have to meet the same standards as a brand name drug.
Okay, so that is how we're able to get to that $6 billion savings, because of the option of using generic drugs.
Exactly.
As opposed to the name brand
Right.
drug, and the name brand drugs, excuse me, are able to recoup their money.
Right.
So they're okay with that.
Right. They're giving us
Got it.
we're actually giving discounts on for Medicare patients who have particular brand name drugs. There are up to 50, I think in 2012, up to 53% discount on brand name drugs.
Excellent.
And so one more little tidbit, even when they get in even in the donut hole, the full cost of the drug is still being counted towards the closing the donut hole. So they're not losing, or it doesn't take them longer to get out of the donut hole, if you will, but all those costs are being added up to improve the care and access to the medications.
Wow.